Hello, my name is Dr. Kevin Tay, Senior Medical Oncologist from OncoCare Cancer Centre. I will be discussing the topic on understanding lymphoma. I will be going through what lymphoma is, how common it is, risk factors associated with lymphoma, and how we diagnose and stage lymphoma and the various treatments available. Lymphoma is a cancer originating from the lymphocytes, which is a type of white blood cell. People are often surprised to hear that, thinking that it's a cancer of the lymph node. That is not exactly wrong. It just so happens that a cancer of the lymphocyte occurs usually within the lymph nodes. Lymphoma is not only confined to the lymph nodes, it may also involve other organs such as the liver and the bone marrow. All of us have two types of lymphocytes, either the B or the T cell lymphocytes. Hence, we can broadly classify lymphomas into B or T cell lymphomas. How common is lymphoma in Singapore? According to the data from the Singapore Cancer Registry, lymphoma ranks as the 5th most common in men and the 6th most common in women. There are approximately 500 new lymphoma cases diagnosed in Singapore each year. We know that the incidence of lymphoma has been increasing over the last few decades, as highlighted in the red circles in the table. This is a similar trend that we observe in other developed countries. You and everyone would like to know how one gets lymphoma. Most of the time, we actually do not know what the exact cause is. There are very few known causes of lymphoma. We know that people who are immunocompromised are at a higher risk of developing lymphoma, such as people with autoimmune disease or after an organ transplantation. We know that people who have been exposed to certain toxins or heavy chemicals such as benzene or radiation exposure may predispose to lymphoma as well. There are also a few infections that have been associated with the risk of lymphoma, such as Epstein-Barr virus, HIV, and Helicobacter pylori. For the majority of patients, we will never know what caused the lymphoma. Most patients with lymphoma present with some enlargement of the lymph nodes. Frequently, they feel a lymph node, and that's how they present and go and see a doctor. Keep in mind that with lymphoma, it is also one of the more difficult cancers to diagnose, as it may not always present with lymph node swelling. It may sometimes present with symptoms such as tiredness, weight loss, or generalized itching or night sweats. Once lymphoma is suspected, the workup usually involves a biopsy of the lymph node or the affected area to confirm the diagnosis. The next step of the workup is then to assess the extent of involvement of the lymphoma. That usually requires a full body PET scan or a CT scan. Lastly, a bone marrow biopsy is often done where a sample of the bone marrow is taken to look for any involvement of the lymphoma within the bone marrow. Once the diagnosis has been confirmed, we then proceed to staging. There, you're trying to establish how extensive or widespread your disease is, because that may impact your treatment as well as your prognosis. Stage 1 is one lymph node region. For example, if there are multiple lymph nodes in the neck, that is considered as one region, as shown in the picture on the far left. Stage 2 is 2 or more lymph node regions involved on the same side of the diaphragm. Either all the lymph nodes involved are above the diaphragm or all the lymph nodes are below the diaphragm. Stage 3 are lymph nodes involving both sides of the diaphragm. And stage 4 means that the lymphoma has spread beyond the lymph nodes and into other organs such as the bone marrow, the liver, and many other organs such as the skin, the brain, and the kidneys. But the most common by far are the liver and the bone marrow. Within each of the 4 staging systems, there is an A and a B. A means you are asymptomatic, meaning you have no symptoms from your lymphoma. And B means you have B symptoms, and there are 3 of those: fever, night sweats, and weight loss greater than 10%. In general, B symptoms mean that you have a more aggressive disease or more widespread disease, and those will have impact on your treatment and prognosis. Lastly, we will go through the treatment of lymphoma. The mainstay of treatment for lymphoma is chemotherapy. The type of chemotherapy depends on the subgroup of lymphoma, as there are over 60 different types of lymphoma. The majority of lymphoma are non-Hodgkin's lymphoma, which accounts for 90% of the cases, and 10% are Hodgkin's lymphoma. This differentiation is based on the pathological diagnosis made under the microscope. So for this video, we will focus on the non-Hodgkin lymphoma. Most non-Hodgkin's lymphoma are B-cell lymphomas, but there are a smaller subgroup of T-cell lymphoma, and that can make a difference in how we treat you. In addition to the type of lymphoma, it can be further subdivided into whether it is fast-growing, meaning aggressive lymphoma, the most common being diffuse large B-cell lymphoma, or a slow-growing, meaning indolent lymphoma, such as follicular lymphoma. Treatment of aggressive lymphoma, such as diffuse large B-cell lymphoma, which tend to grow more rapidly and have a more aggressive disease and therefore needed to be treated more urgently and intensively. For diffuse large B-cell lymphoma and other aggressive lymphoma, they are treated with a combination chemotherapy. The backbone chemotherapy is a combination of drug called CHOP, an abbreviation for 4 chemotherapy drugs. Frequently in B-cell lymphoma, in combination with chemotherapy, we also add an antibody called rituximab. There are also other various chemotherapy options used in other aggressive lymphoma, but rituximab with CHOP chemotherapy is the main standard regimen used in diffuse large B-cell lymphoma. The CHOP regimen can be done in the outpatient clinic. It is given every 3 weeks. This is what we call one cycle of treatment. It is given up to 6 to 8 cycles of treatment with a minimum of 6 cycles. Aggressive lymphoma, even though has a more aggressive cause, but is still considered potentially curable. In contrast to aggressive lymphoma, the low-grade lymphomas such as follicular lymphoma can be much more indolent or slow-growing. Depending on the subtype of indolent lymphoma, you may not need any treatment right away. Many patients can be observed, especially if they have no symptoms or they have fairly isolated disease or slow-growing disease. The decision to treat you are based on factors such as symptoms that you might have, or if you have a rapidly growing disease. Those are all indications for treatment. If you do require treatment for follicular lymphoma, the treatment used is often less intense than for large cell lymphoma, maybe involving 1 or 2 drugs. Sometimes we can just use rituximab alone, for example, or you could use rituximab in combination with 1 or 2 other drugs. So there's a lot more variability in how we treat indolent lymphoma, as in when to stop treatment, when to initiate treatment, and the number of drugs that we use. The low-grade lymphoma has a more indolent cause, but they tend to recur and may require repeated treatments at different time points in your life. So they are considered more of a chronic disease. The treatment of lymphoma may include other modalities such as radiotherapy, stem cell transplantation, or what is commonly known as bone marrow transplant. The stem cells may be collected from yourself, and that is known as autologous stem cell transplant, or if the stem cells are collected from other donors, that is known as allogenic stem cell transplant. There are also other newer treatment options such as immunotherapy, for example CAR T-cell therapy, which is simply put a way to modify your own T-cells to better enhance the T-cell capabilities to kill the cancer cells. Unfortunately, CAR T-cell therapy is still not currently available in Singapore, except on a clinical trial basis. With the exception of radiotherapy, these other treatments that are mentioned are not standard treatment in newly diagnosed lymphoma patients and are usually reserved for use in the relapse setting. Being diagnosed with cancer is never easy to deal with, but fortunately, for many of our lymphoma patients, they have a disease that is responsive to treatment. And for many of our patients, they can be cured from their disease and continue to live a happy and normal life. But do know that you are not alone in this walk, and there are many resources out there and support in your community to tap into. One such resource is the Singapore Cancer Society website at www.singaporecancersociety.org.sg. I hope this video has helped you gain a better understanding of lymphoma. If you would still like to know more or to discuss more about your lymphoma condition, you may contact my clinic at 6694-1721 or email me at enquiries@oncocare.sg to make an appointment with me for more consultation. I wish you all the best and good luck with your journey through cancer.